everything that you do in your daily life in some part relates back to your ability to generate force, right? So get yourself up out of a chair, to go up and down the stairs, right? To keep your balance when
Mm.
you're carrying the groceries. All of those things relate back to your ability to produce force. And the stronger you are, the more submaximal those tasks become.
Wits and Weights community, welcome to another episode of the Wits and Weights podcast. Today, I've invited on John Petrizzo, a physical therapy trainer, advisor, coach of mine, whom I met in Andy Baker's Barbell Club. And I wanted to bring him on because of his unique combination of physical therapy and barbell training. He and I have had a few conversations leading up to and then after my rotator cuff surgery, where he gave me some great advice to help me accelerate the process of getting back to what I love, which is training, building muscle, and being active. And I wanted to dive into some of these principles so you can benefit from his tremendous expertise. John will dismantle some of the more pervasive myths about strength, recovery, and mobility. We'll discuss how to merge the worlds of rehab and strength in a framework that could drastically change your approach to injury prevention and rehab. From post surgery recovery to the cautionary advice you often hear in traditional physical therapy, you'll learn why strength isn't just about lifting weights, it's really a fundamental attribute that influences every facet of your life. John Petrizzo is a physical therapist, certified strength and conditioning specialist, starting strength coach, and an associate professor in the Department of Health and Sports Sciences at Adelphi University. Sorry, man, it's a mouthful. he holds a BS in exercise science from Hofstra University, where he was a member of the football team, and a doctorate in physical therapy from the New York Institute of Technology. John has worked in the fitness industry since 2006 in a variety of roles and settings and has helped many patients and clients achieve their health, fitness, and sports performance goals through barbell training. In 2012, John also began competing in powerlifting. John, man, it is an honor finally to have you on the show.
Thanks so much for having me. It's a pleasure to be here.
So let's get to know you a bit. You have this uncommon dual practice that I think it's uncommon, maybe it's not, but it combines physical therapy and barbell training. So tell us how that came to be and tell us some of your guiding principles behind that.
Sure. So my interest in training started, way back when I was a teenager. I played a lot of sports growing up, and became interested in lifting specifically to try and improve my performance in athletics. Wanted to get bigger and stronger, like a lot of high
Mm.
school guys that play football, and I also played basketball and lacrosse in high school. And wanted to try and continue to play in college. So I saw, weight training as kind of the key to that. And then once I got into college, I had to figure out, what I actually was going to do there academically, and decided on majoring in exercise science. I didn't really know much about it, to be honest, at the time. I just knew that it sounded like it aligned with my interests.
Mm.
And once I graduated, I started working as a personal trainer, at a large commercial fitness facility, which I really enjoyed. And, I finished up college. I continued to train, and meaning train myself. And, you know, ultimately, I became interested in physical therapy a little bit because there was a PT clinic in the gym that I was training people at. And I just kind of became curious about, what it was that they knew, about the
Mhm.
body and about, rehab and performance that I didn't know. And it kind of piqued my interest and made me want to pursue that. So I ended up applying for, grad school for physical therapy and doing that. And, once I was in the program, and certainly, I mean, I learned a ton, but I also realized that, you know, not a lot of people that were involved in rehab really knew or had a ton of interest in strength and conditioning, so
Mhm.
I was a little bit unique from that standpoint. I think it's becoming more common now, but that's really where it started for me, and once I got out and started practicing, it really was about, taking the things that I knew about training and strength and conditioning and kind of applying that to a rehabilitative setting. I wanted to
Mhm.
be able to work with people from across the continuum, whether they needed, strictly rehabilitation, whether they're looking to improve their, sports performance, or, get stronger. I wanted to be able to do all of that, and that's really where it started for me.
Yeah, and it sounds like it's a really natural combination of things because we all experience injuries, surgeries, and issues over the years, and there does seem to be a gap, at least from the layperson's perspective, from both sides, from trainers who don't quite understand movement patterns and injury, and maybe don't even want to go there for liability reasons, and then physical therapists who, just from personal experience, very few of them seem to understand lifting. So, and or it's this attitude of like, well, if they know me as a lifter, they're like, you've got your strength stuff. We're going to focus on the range of motion stuff. And I'm like, well, isn't there an overlap there? How
Right.
how common do you think it is becoming, even though it's still uncommon? Like in any given town in the U.S., for example, could you find somebody in your radius that is like guy like you?
Probably not. I mean,
Yeah, yeah,
so for me, when I say I feel like it's more common, that's probably a little bit biased because of, the people that I associate
sure.
with and, that I tend to follow through social media and things like that, which makes it feel like, yeah, this is becoming
Hmm.
more common. But still, when you think about in your, like you said, your average PT clinic, outpatient orthopedic PT clinic, you're probably not going to have a PT there that really understands. Let's say if you come in as a lifter, right,
Yep.
you're a competitive power lifter, you're an Olympic weightlifter or something like that, you're probably not going to have somebody there that necessarily understands what you're trying to get back to,
Hmm.
and that's unfortunate, but I think that's kind of the reality of the situation. I think a lot of the people that do have that expertise tend to, they start their own businesses and
Sure.
things like that. They don't want to work with insurance. They're out of pocket. You know what I
Makes
mean? I
sense.
mean,
Yeah.
that's what my wife, she ended up doing. And, so you may have some luck maybe at like a CrossFit facility or something, where they have someone there like that. But your typical like outpatient orthopedic insurance based clinic, probably not.
Yeah. And it's great that we do have the ability to connect online today, like I did with
Mhm.
you. And I wanted to bring you on this show because I just truly believe in what you're doing and how it can help people. So as people are listening or watching this, John is a guy you can reach out who may not be local, but to give you some direction at least. So let's touch a little bit on training and rehab and combine the two. You're
Mhm.
a big believer in barbell training, as am I, and you even compete in powerlifting. I guess there's some debate with people still about whether barbell training is beneficial or not for the average person, right? I get questions like, is it safe? Can you train with barbells over the age of X, right? 40,
Right.
50, whatever.
Sure.
Just just break it down in simple terms. What's the philosophy behind why you believe in barbell training?
Well, the first thing I would say is, does anybody have to do barbell training? I mean, the answer is obviously no, right? There's nothing that
Mm-hmm.
you absolutely have to do. You can make plenty of progress in a variety of different ways using resistance training, right? But, barbell training to me is something that is a lot more accessible to people than they realize. And, the benefit is, just from in my opinion, the efficiency with which you can train large groups of muscles, right? Large amounts of muscle mass through long ranges of motion, using what we would consider to be fairly normal human movement patterns, like the squat, like the deadlift, which is just picking something up, like the press,
Hmm.
and those sorts of exercises. They have a ton of carryover to our everyday activities. I think an additional benefit for people is that they incorporate the majority of them incorporate at least some sort of balance component, right? So you can get a lot of benefit with just a handful of basic exercises or movement patterns, and that's what I think the average person doesn't really see. They kind of
Right.
look at this as, that's a bodybuilding thing,
Mm.
that's a weightlifter thing, and I don't need to be doing that. And it's, again, you don't need to be doing that, but you might find it to be way more beneficial than you realized. And to me, it's really just about finding an appropriate starting point, and
Hmm.
that's where a coach or someone with experience in this stuff can really make the difference. So
Agreed.
knowing what sorts of maybe equipment modifications do you need? Do you need a lighter barbell? Do you need, what I mean? Do you need
Absolutely.
Do you need to modify the range of motion of the exercises initially? Those are the things where a coach can really help someone get off on the right foot and have a positive experience with this stuff, and then it starts to build on itself over time.
Yeah, I agree with everything you said. I mean, there's some things in there, like the fact that it's accessible and safe, I think is lost on some people until you kind of run them through the scenario of increasing your barbells with or increasing dumbbells with progressive overload and some of the safety challenges that come with that, or even just practical challenges of going up in certain increments and the availability of all these dumbbells. Like you said, 15-pound bar, empty bar, whatever it takes
Mhm.
to start. and
Mhm.
and then the balance and mobility, stability, all of that is can't be overstated, I think, for folks.
Yeah.
Yeah, yeah.
And
So yeah,
and
go ahead.
and I would just say people that haven't done it,
Mhm.
they can't really understand what we're
Right.
talking about, So
Sure.
that's kind of the barrier for some people, and I think that's where it becomes an issue from a rehabilitative standpoint with physical therapists, right? So, or even lots of physicians, they're very quick to tell people, "No, don't do that. You're gonna hurt your back, you're gonna hurt your knees, you're gonna hurt your
Mm,
shoulders," whatever it is, when in reality, they're just that take that with a grain of salt because
yeah,
more than likely they've never done it themselves. They've never gone through the process of learning how to do those things, and it's really outside of their area of expertise. But they throw those comments out there because they just make assumptions about it, right? And
for
and
sure.
that's a hard thing to overcome, certainly.
It is, and I've had 3 surgeries myself, one of which was a back surgery, and without deadlifting, I'm not sure where I would be. In other words, the positive side of it, being able to
Mhm.
recover and get strong again, right? Where
Right.
where oftentimes you're told, "Well, I'm not even sure you're gonna deadlift again," or,
Yeah, of course.
things
Yeah.
like that.
Hmm.
Um, so speaking of those kind of, I guess, counterintuitive lessons, myths, whatever we want to call them, since you've been in the game since like 2006, right? Working in physical therapy and as a strength coach,
Hmm.
what is one of the biggest or the most maybe counterintuitive lesson about strength and mobility that you've discovered in your years of practice?
Well, I think again, this is probably something that is counterintuitive to a lot of people, but the two really go hand in hand, right? So, if you're
Mhm,
if you're
mm,
training through a full range of motion, you're squatting to below parallel, you're pressing over your head through your full shoulder range of motion, then you're building strength and mobility
mhm,
simultaneously, and I think that's another misconception people have is like, well, if I lift weights, I'm just going to get tight, and you know what I mean?
mhm,
Like that kind of thinking still persists today, which is kind of crazy for those of us that are uh a little bit more educated about this stuff. But I'm talking about the way like the general public kind of looks at it, right? And
for
and
sure.
they don't and over the years there have been a number of people that have told me, wow, I can't believe like how much better I'm moving, how much more flexible I feel, even though actual dedicated flexibility training really only makes up a very small part of what they're doing with me. So I think that that's probably the biggest thing.
So let's take a very specific example of that, right? This morning I did the pec deck flies for the first time. This was at the end of my workout
Hmm.
because I had left rotator cuff surgery and I'm trying to like work that capsule every way I can and get it stretched out.
Hmm.
And I took video of myself and I noticed, the affected arm, the angles are just way off from my good arm still because
Hmm.
it's, and even though in my head they feel symmetrical,
Hmm.
and it started to get looser and looser even though I wasn't doing stretching, I wasn't using bands, I was just lifting.
Right.
What I guess when you think of the physical therapy concept, what's the value between the range of motion, isometric and stretching type work versus just say lifting with certain movements that use the same joint, if that makes any
Hmm.
sense? Yeah.
Well, the way that I always kind of describe it to people is that you only get stronger through the range of motion that you're training through,
Mhm.
right? So we want to train through the full available range of motion, provided it's safe, it's not painful, right? Those sorts of caveats. Now, with like specific flexibility work, you're obviously going to get some specific benefit from that, but you don't get the strength benefit
Mm.
simultaneously, right? Now, with the flexibility work, you can, maybe work through to through a further range of motion, right? Get to a further endpoint if that's your goal. But um, than you can with the resistance training exercises. But in reality, The way that I look at it is if you have the range of motion to do everything that you need to do, right, in your day-to-day life, then do you really need to spend a bunch of additional time doing flexibility exercise just to achieve some kind
Mhm.
of arbitrary, endpoint that you're trying to get to,
Mhm.
and
Sure.
obviously, like if you're a gymnast or a dancer or something, then you need a different degree of flexibility and mobility than the average person does. But for most people, just doing full range of motion resistance training is going to give them a pretty good flexibility stimulus and keep their mobility at a above average sort of
Yeah.
level. Yeah.
Can definitely vouch for that. So let's talk about post rehab or post surgery recovery then,
Mhm.
because again, I'd like to throw my personal story in there because that's how we met, and I'm experiencing it right now. After I was cleared to start lifting by my surgeon, I reached out to you for advice. You pointed me to some rehab movements that could increase shoulder range of motion. So again, these weren't loaded movements; they were rehab. Just what you're saying there. Sometimes we do need those.
Yeah.
But you also made my day because you said, "Hey, I think you can start benching again." And I was like, I honestly had not even thought that that would be possible, and I was almost scared to. There's this
Mhm.
fear, right? That like, oh no,
Sure.
I'm just gonna tear the tendon again. And so here I am following a linear progression again, back to getting to bigger loads, without the pain I used to have. So, what is your general advice? We can't cover all the types of surgeries, right? But
Sure.
what's the general advice and philosophy for recovering from surgery?
Mhm.
Understanding everyone's situation is, of course, unique.
Yeah, so the first thing I would say is, depending on the surgery, and you just went through this with your rotator cuff, there is going to be a period of time where, for a lot of surgeries, you have to protect the surgical site, right? So,
Mhm,
I typically am not having people, back to doing anything overly aggressive on that surgical site right away, but I do want them to train everything else as normally as possible as soon as possible, right? Because you want to maintain as high a level of fitness as you can. You don't want to
yeah.
totally detrain. So if you have a rotator cuff surgery and you're in a sling for anywhere from 4 to 6 weeks, usually is
Mhm,
the time frame that most people are recommended by their surgeon. Well, do as much lower body training as you can. Train your opposite arm. There's actually research that shows that there's some positive carryover to the affected side, even during periods where it's immobilized, if you're training the opposite limb. So I definitely encourage people to train everything that they can during that initial recovery phase. And that could be, a couple of weeks. In cases where I'm kind of just consulting with somebody remotely, like I did with you, I'll be
mhm.
a little bit more conservative than if I'm
Yep.
working with them in person, obviously. So a good kind of, you know, frame of reference for most surgical procedures, if there's a repair, right? Like they reattached your tendon, right? Your
Mhm,
rotator cuff tendon, or a reconstruction like an ACL or something like that. Um, you know, I would say like 4 to 6 weeks before you're really going to start to challenge that area, and over the first those first few weeks you are going to do more kind of traditional rehabilitative stuff to the directly for the surgical site. And in the case of the shoulder, like you had, really initially it's about getting your range of motion back, and a lot of passive stuff, because the
mhm,
surgeons don't want you really forcefully contracting
mhm.
that musculature that's still healing, because the repair is not very strong yet, right?
Yeah.
um, so that initial phase is really building back the range of motion in most instances, while you're kind of working on everything else that you can, and then after that, those first several weeks, then you can start to kind of directly challenge the area that you had surgery on, right? And again, it'll vary depending on what you had done. But the approach that I always take is a linear progression type of approach. And when you understand the reason why we use it in strength and conditioning, way, from that perspective, it's because you're very far away from your ultimate potential, right, for strength
Hmm.
development when you're first getting started as a novice lifter. So you can make very rapid workout to workout progress for at least several months typically, right? Well, if you were a lifter that just had surgery, now that area is detrained. So you kind of by default go back to being a novice to a certain extent,
Yeah.
right? And you can utilize that very simple linear type of loading model um, for several months after surgery, usually. And, you're going to find a starting point in terms of range of motion and in terms of load that is comfortable for you, right? That's pain is an indicator that you're maybe pushing a little bit too hard, right? You don't want your pain level to be getting worse while you're training. So if you kind of use that as a guide and you find an appropriate starting point, then it's just about progressing a little bit each
Yep.
session, and you'd be amazed at how fast the progress is you could make.
Yes, firsthand for those listening. So what John had me try was bench pressing with a limited range of motion. So I used pins in a rack. I came down literally just a few inches below my, taking it out of the rack from the top position the first time with like an empty bar. And then I would lower the range of motion with an empty bar. Then I would add, say, 10-pound plates with the same range of motion, right? And so kind of back and forth until I got to a full range of motion bench, which felt great, by the way. It almost felt better than doing the pin version of it, right? Because you get that natural stretch
Hmm.
at the bottom.
Hmm.
And each time I did it, I noticed that if I increase the load too much, you might get a little bit of feedback that maybe this is going to cause pain, and then you back it off. But as long as you don't have the pain, it's incredible. 5 pounds every time, 5 pounds every time. And within a few weeks, you could go from wherever you were to double where you were potentially, because you're still submaximal relative to your personal original strength that you were at. So just for those listening, it definitely works. And you have to be patient, but you don't have to be so patient that you're not still making good progress. Is what I'm
Right.
saying. Yeah.
And I think if you compare that to, a more typical physical therapy approach,
Hmm.
I've been in so many clinics and seen over the years and talked to patients over the years that, they go in, they have their exercises, they're very isolated exercises, right, for the specific area that they had surgery on. The rest of the body kind of gets ignored, and they are not progressed over time, right? So it's kind of like you start doing your shoulder internal and external rotation and maybe some, scaption exercises and different things like that with very light loads. And then, you're doing your couple sets of 10, 15 reps, whatever it is. 4, 5, 6 weeks later, you're still doing the same stuff, right? With the same resistance.
Hmm.
And maybe they feel better, but it's not because of the exercise, right? The exercise isn't driving any sort of improvement. You're just feeling better because now you have more time since you had the surgery
Healing.
and you're
Yes.
healing. So I think that there's a big misconception there, right? I want to use the exercise as a driver of adaptation, right? To
Yes.
help you, get physically stronger and develop your muscle mass again, as opposed to just waiting around for things to feel better.
Yeah. Absolutely, bar none, for sure. So let me. I wasn't going to ask you this, but in my gym, I noticed I had my BFR kit that I haven't used in a long time because I bought
Mhm.
it for fun a few years back. Do you ever get into that blood flow restriction?
So I have some experience with that. I've actually done a little bit of research in that area,
Okay.
and BFR is not a bad tool. And basically, what the research on BFR will tell you is that you can get a similar type of training effect to a heavier load using lighter loads, right?
Hmm.
And
Hmm.
the thought process is by partially occluding the blood flow, it kind of, gives you this different adaptive stimulus. And what I would say is it can be useful in certain situations, but it's not a necessity. Over
Hmm.
the years, more recent research regarding resistance training shows that for relatively untrained populations, you can get a lot of benefit with lighter loads, provided you're taking them very close to failure, right?
Hmm.
So BFR is kind of a similar concept. What I would say in regards to training to failure and BFR, those two approaches, which certainly can be effective, is that they're not for everybody because they can be really uncomfortable, right? And
Yep.
to me, it's like if if you're using a protocol that doesn't foster good adherence, right? If a person just is miserable and dreading having to go to the gym because they know they're going to put this cuff on and it's going to,
Yeah.
be super uncomfortable to do their resistance stuff with it, then I don't see it as super valuable. But for people that can tolerate that and that enjoy that, then it can be useful, but
Yeah.
I don't think it's a necessity by any means.
Okay. I mean, the reason it came into my brain was I was like, I was unhappy with the diameter of my left bicep versus my right because of the what do you call it, atrophy, I guess, that occurred.
Yeah,
I'm
sure.
like, can I, besides the just bicep tricep work that I'm throwing in there, can I enhance that with a little BFR work, or is
Mhm.
it just a little bit more volume of standard lifting that's going to do it? You know what I mean?
Yeah, and that's the issue when you look at a lot of resistance training research. It's all done on relatively untrained populations.
Right.
Every once
Or
in a
very responsive either way.
Right,
Yeah.
exactly. So they're relatively untrained, so they're gonna get a really positive response, and it makes it a little bit trickier for someone like yourself who's more highly trained, to be able to pull from that research and say, "How does this apply to me?"
Yeah.
So I would say you can try it, but I don't think it's a necessity.
Got it. Just curious. I don't think I've ever brought it up on the podcast, so people were curious. All right. So one principle you've written about, I think, in the Starting Strength website, you've got a few articles up there, is just this idea, kind of taking a step back, that strength is the most important physical attribute because it affects all other aspects of human performance and well-being. So can
Mhm.
you elaborate on that just so people understand? We talked a little bit about barbell training, but just strength overall.
Yeah, I mean, that's something certainly that has become more clarified for me over time,
Mm,
especially working as a physical therapist. I think when you're younger and, you're more into athletics and, maybe training for aesthetics and things like that, you don't really understand how important strength is to your everyday life. Now, as a PT, I work with lots of older people.
mm,
I've had people up into their 90s that I've worked with, and when you see the difference that physical strength can make in their quality of life, it's amazing. I've had people go from wheelchairs to walkers to canes, just because they doubled the strength on the leg press that they were doing, and
yeah.
it's just it like you said, it has an influence on everything else that we do. We talked about a little bit the relationship to mobility and flexibility. Getting physically stronger will have a positive impact on your endurance. Again, certainly more of an impact if you're relatively untrained and previously sedentary. If we're talking about a high level endurance athlete, that's going to be, less the case. But so it just has carryover to everything that we do. Everything that you do in your daily life in some part relates back to your ability to generate force, right? So get yourself up out of a chair, to go up and down the stairs, right? To keep your balance when
Mm,
you're carrying the groceries. All of those things relate back to your ability to produce force. And the stronger you are, the more submaximal those tasks become.
yeah. Yeah, I mean, it reminds me of like John Sullivan's term, the barbell prescription, which is the title of his book, but
Hmm.
that being strength being the prescription for aging, to the
Yeah.
point where, I mean, I would go out and state that you almost have to have it in your life if you're going to be, fit for a long time.
Hi, this is Alan. I just want to give a shout out to Philip Pape at Wits and Weights for his nutritional coaching. His coaching is based upon science, research, intellect, and wisdom. His coaching is safe, supportive, connecting, and it actually has helped reset my compass in terms of how I direct my health, the action steps I do, and really, really has helped me regain trust and belief in what my body can do and how my body can change.
So on the other side of the coin, right, we have the mainstream fitness industry and the mainstream physical therapy industry promoting lots of methods of exercise.
Hmm.
They don't always directly produce or increase strength. Like, well, we have cardio. I mean, cardio is good for a lot of reasons, but you've got cardio,
Sure.
you've got isolation work, single joint work, the
Hmm.
functional movements, the lighter weights, higher
Hmm.
reps, bands, and so on. What are the limitations of those? Is there a place for these? People get very overwhelmed with all these ideas. You talk about barbell training and then there's all these other things. So
Sure.
how can we clarify it for folks?
Well, I think, and the way that I describe this to my students, and again, anything is better than nothing, right? If the
Mm,
choice is functional training or sitting on the couch, then go ahead, do as much functional training as you want,
mhm,
but if we're talking about, efficiency, and if we're talking about maximizing the benefit of the time that you spend exercising, I think that really, the traditional strength training exercises can't be beat from that perspective. The problem with all of those other modalities, if we're talking about functional training or isolation exercise and things like that, is their ability to be progressed over time, right? How do you progress a functional exercise? How do you progress an isolation exercise? Functional exercises are really more displays of the ability that you already have, right? In terms of your
mm,
balance and that sort of thing, as opposed to developing those characteristics further. And, so that's different than if every time you go to the gym, you add 5 pounds to your deadlift, right? That is developing your strength. The isolation exercises, they're self limited by the fact that they don't involve a lot of muscle mass, right? So
mhm,
their ability to be loaded progressively is more limited, right? You can
yep,
progress on a squat for years. You can progress on a knee extension for weeks, maybe
mhm,
months,
yeah,
but you're going to hit a wall at some point where you can't do more reps, you can't do more sets, and it just becomes a limiting factor because the amount of muscle mass that you're using. So to me, there's kind of a point where all of those other modes of training at some point are you get more diminished returns than you get with the traditional strength training exercises.
I love it. So you clarified it really to I'm gonna just put words in your mouth. Two big principles that I heard there. One is just the time efficiency perspective. And
Right.
I like to call it the lazy person's way to work out. It's like barbell training. When I found that, I said, man, I only have to work out 3 or 4 days a week for an hour. I don't
Hmm.
have to do almost anything else really and still get a huge amount of results, which
Yeah.
was liberating. When I have clients who come in, especially women who are working out 7 days a week and they're
Hmm.
running and doing a million things, I say, well, we're just going to cut out a whole bunch of things.
Yeah.
And you get the look like, really? And they start getting results and the stress goes down and the sleep goes up. You're just,
Hmm.
people are floored by that. And then the progressive overload can't be overstated. I'm going to call it infinite progressive overload, is kind of what you implied, that there really is no end in sight when you're using all that muscle mass in those natural patterns.
Hmm.
And you're right, things like knee extensions, they get tiring after a while. You have to rotate them out. You have to get clever with
Hmm.
rep ranges and all this other stuff, but you don't have
Sure.
to do that so much with squats.
Right.
Yeah.
So I would say, if you enjoy that stuff, then
Hmm.
supplement your basic training with a little
Yep.
bit of that. That's fine, and there's nothing wrong with, having some variety and doing some of that stuff if you enjoy it. But, I don't think that they're really good building blocks to like form the foundation of a
There
good
we go.
program. Yeah.
Yeah, and that is a third. What you just mentioned, is it fun? Because really, at the end of the day, you do want to stick to something. Andy's really good about that in his program. He understands
Yeah.
the practical side of it. You've got Rip over here saying just do the program right, and
Mhm.
and then we kind of add some variety over time.
Mhm.
Um, how do you determine when barbell training then is appropriate for, or maybe contraindicated for, a patient? Like a physical therapy
Mm.
patient comes in, you're not sure of their history from day one. Would it be appropriate or not?
Well, I mean, one thing, when I'm dealing with patients, first I do get a lot of people that come to me because they
Yeah,
strength train, right? So that my perspective is probably a little bit biased. So those people, it's a no brainer. I mean, that's what we're going to do, right? But for
self
the
selection bias. Yeah.
Right, right. But for the average person, one, they have to show a little bit of interest in it, and in my
Mhm.
clinic, when they see other people doing it, sometimes they'll start to ask questions about it. They'll say, hey, and they see a 75-year-old woman deadlifting and they're like, can I do that? And I'm like, yeah, of course you can do that. Do you want to learn how to do that? And they're like, yeah, why not? You know what I
Mm,
mean? So sometimes it kind of feeds on itself when they see other people doing it. It makes it less intimidating, and it makes them realize that, hey, I actually can do this stuff. Look, that kid is doing that, that older person is doing that, and they look like they're fine. So it
yeah.
makes it less scary for people. But um, another way that I'll get to it sometimes, if the person maybe is not naturally curious about it, which does happen. But let's say I start somebody on a leg press, and then I progress them to a body weight squat, and then I progress them to a goblet squat. And then I get to the point where I say, well, you know what? That weight that you're holding, that's actually the same weight as the bar. So why don't we just try to do it with the bar? And they're like,
Mhm.
oh, okay. Or if I'm doing like a deadlift pattern and, we're using a kettlebell to start and we kind of progress that to the point where I'm like, hey, that's actually the same weight as this. Why don't we just do this? And then they're
Mhm.
like, well, if it's the same weight, why not? You know what I
Yeah,
mean?
just a
So
different tool,
it's
yeah.
yes, exactly. So that's almost kind of like I trick them into into
Yeah, I get
doing
it.
that. But that seems to work pretty well too.
It's for their own good.
Right. Yeah, exactly.
No, that's cool. I mean, you are in a position of trust or authority or whatever you want to look at it, where
Mhm.
you kind of develop that over time, and that makes a lot of sense. It, okay, okay, cool. So, do you ever get weird looks from patients when you recommend or prescribe barbell training, and they're not really sure, they don't really know you? I mean, does that situation come about?
I mean, yeah, and again, like I said, I don't force it on people.
Yeah,
Like if someone is like, "Listen, I just don't want to do this," I'm
yeah,
not. I've said, "Okay, we'll figure something else out." Um, but I do try and what I do try and be very upfront about is, my rationale for doing things with people. So I always try and explain to them, this is what I want to do, and this is why I think it would be beneficial for you. And if you have a good rapport with the person that you're working with and they have trust in you and they think that you're a competent person and you can clearly explain your rationale, then that breaks down a lot of the barriers that people put up to it.
for sure.
Yeah,
Agree. Yeah, I mean,
so I think
yeah, yeah.
just good communication is super important.
Yeah, absolutely. And even what you just implied even more deeply than that is the empathy and meeting somewhere where they're at, and understanding people's where they're coming from, right? It's a huge
Yeah,
part of coaching.
of course.
Yeah. Okay, so earlier we talked a little bit about mobility and flexibility,
Hmm.
which are sometimes thrown around interchangeably, or people are confused about the differences. Let's take a squat, for example, just a typical squat, low bar back squat, and someone hasn't had success on their own because of fill in the blank. Maybe they say my hip flexors are tight, right? Or and when you look at them, they're say in their 40s, they're relatively quote unquote fit,
Hmm.
and they're just for whatever reason not getting this full range squat. How would you address that situation?
Yeah, for that sort of thing, a lot of times it's not necessarily a flexibility, limitation. Now,
Mhm,
and when I say flexibility, I'm meaning like a muscular tightness thing. So
mhm,
like the hamstrings get blamed on a lot of stuff,
mm,
then oh, my hamstrings are tight, so I can't do this, I can't do that. And in
yes.
reality, it's usually more about coaching the person through the movement properly, right?
Mhm,
And making sure that they know where they're supposed to get to, you know what I mean? Showing
mhm,
them, "This is where I want you to go, this is how we're gonna get there," and kinda walking them through that process. Now sometimes people do truly have a limitation, maybe that's a limitation in their joint mobility, because they have osteoarthritis or they have some sort
mhm,
of bony anomaly. So those are the types of things that you can't force people through, and that's really, super important. I think sometimes we just assume everything is like a flexibility issue, and a lot of times that's not the limiting factor. If you've coached the person as well as you can, and they're still kind of having trouble, then it might be a joint issue that they're dealing with, rather than like a muscular flexibility issue. But that's probably something that, doesn't come up that frequently, you know what I mean?
mm.
So I would say more often than not, it's just probably the person kind of having a lack of understanding of how they need to get to where you want them to go, and
Sure.
it's more
Okay.
of a coaching thing than a flexibility thing.
So let's take a specific scenario. If someone, let's say someone could sit down to a box that's below
Mhm.
parallel,
Right.
is there any reason they can't do that with load? Like, is there any reason where at some level of load, not having progressed there yet, but if they
Mhm.
do, they would hit some sort of wall because of mobility slash flexibility?
No, I don't think so.
Okay.
I think that, and I start people squatting with boxes all the
Hmm.
time. One, for someone who's never trained before, it's a little bit of a security blanket,
Yes.
to know that, okay, I'm gonna touch this and something is behind me so they don't feel like
Hmm.
they're falling. And especially from a rehab standpoint, it can be really useful in a lot of situations. So again, it's just about finding the right load for them to start with, and there's no reason why they can't progress from there. And
Okay.
a lot of times I'll take the box away at a certain point, and then I'll maybe have them do a pause squat, right? So that they
Mhm.
really get comfortable in that bottom position before I'll start to have them actually do, the full squat with the stretch reflex and the rebound and that sort of thing. So, but again, that's a lot of times a progression I'll use from a rehab standpoint.
Yeah. No, I think that's important for people to understand because I always think in terms of like, what are the excuses we make to ourselves, and what do we, and how can we get out of that thinking?
Yeah.
So if you can start with this, and then that means you can eventually get to this. So if you
Hmm.
can get this, that's great
Right.
news. It's empowering.
Yeah, and
Yeah.
even if it's starting with a limited range of motion, right? So maybe they really can't squat to a box below parallel to start because of pain or weakness, and they can't move through that full range of motion. Start them with a higher box and then progress
Yeah.
them, gradually lower over time. So there are all different strategies that you can use. The key is just finding the right starting point for people.
Oh, for sure. And if you have like an elderly mother, for example, who has trouble getting off the couch, maybe you work with her for with a slightly higher chair than the couch, doing some squats there, and then eventually moving your way down. It definitely works.
Yes.
Yeah. Okay. So kind of on the flip side of this is you have experience also working with athletes looking for performance gains. How does your physical therapy knowledge improve their performance? How does that play into your work with them?
Well, I think it's helpful really from the standpoint of avoiding overtraining. Most of
Mm,
the athletes that I work with, their biggest problem is that they're overtraining, and they're
doing
just
too much.
sore and beat up and they don't understand why, and it's like
Yeah.
and the biggest challenge with them is to get them to take a step back actually and do a little bit less and pay a little bit more attention to recovery. That is hard for them, psychologically to say, okay, I'm going to, do a little bit less. But if they do, typically we see much better results, right? And
Mhm.
they feel better, they perform better, their training goes better. You know what I mean? So that's the biggest thing is trying to get to, from my perspective, is trying to get athletes to understand that it's not just your training, it's your ability to recover from your training that is going to dictate how successful you are,
Yeah,
and when we're
for
talking
sure.
about athletes, they have to balance their weight training, their conditioning work, and their practice time, and that's the challenging thing, so I think it's really more stressing how important it is to recover in between your sessions.
Yeah, and I think that applies to also just older lifters who also are so dedicated to their lifting, like many of us in the club, that
Mhm.
we are kind of athletes of a sort, right? We may not be practicing a skill for competition,
Mhm.
but we definitely can get beat up. And I'm curious, in your experience, what are the most, like, say, the top three parts of the body or type or things that get fatigued? And I'm just going to guess low back and shoulders are on the list, but that's just my
Yeah.
guess.
Yeah, certainly low back and shoulders. It's funny when you look at the, um, research related to resistance training injuries, they're really not different than the general population, right? So,
Mm,
like, the general population, what's the number one type of orthopedic pain? Is back pain. Well,
back pain.
what's the most common type of injury that lifters experience is typically low back injury, right? So
Mhm.
so that's I try and stress that to people too. It's like, well, you could hurt your back doing, anything around your
That's right.
house. It's just like you can tweak your back deadlifting. So it's not that that makes the deadlift dangerous. It's not like you would avoid doing stuff in your everyday life, hopefully, to because you're worried about tweaking your back. So, but yeah, backs and shoulders, certainly super common for lifters. Hip and knee, maybe a little bit less so. I see more knee stuff with like my, like high school and college athletes and
Mm,
weekend warrior type people that are doing a lot of additional stuff outside of lifting,
right.
but certainly backs and shoulders are super common. And, stuff that lifters, elbow tendonitis and, or tendinopathy, just from
Yes.
overuse and that sort of thing is very common too. But in terms of like little bit more serious stuff, it's usually backs and shoulders.
Makes sense. Oh yeah. And so speaking of the elbow stuff, I used to have definitely because of my squat grip. What do
Mhm.
they call it? Medial epicondylitis, right?
Right.
Golfer's
Yes.
elbow. And
Yep.
I actually followed the pin firing approach and
Mhm.
switched to an easy bar for my curls and fixed my squat grip. So three training variables that I changed.
Yeah.
Not sure which one fixed it, but something did.
Right.
What's your opinion on pin firing? Because I know it's controversial.
Yeah,
You
I
know.
mean, it's typically not something that I do with
Okay.
patients just because it's so aggressive, right?
Yeah.
And you know that you're really gonna flare things up in order
Yeah.
to, get it to heal, and that's not super appealing to most people,
Okay.
would I maybe try it for myself? Yeah, I wouldn't be
Yeah.
opposed to doing that, right? But usually what I do is I look at, all right, what what is the variable that's probably causing this and how can we address that, and like you just said, you altered three variables. So I always try and do one thing at a
Of
time from a
course.
rehab standpoint, because then we can kind of assess, okay, so now we modified your squat grip, let's do that for a couple weeks, use this new grip and see how things start to feel. If that's not working, okay, maybe we need to adjust your grip on your assistance exercises or whatever the
Hmm.
case is, like you
Hmm.
did with the easy curl bar. That's a super simple thing, but, I try and kind of layer changes in one at a time.
Yeah, that makes sense. I'm impatient, that's all, you know? So, no. No, I get it. I mean, when you're doing stuff yourself, it really is it's sometimes a process of experimentation too, because
Of
you just
course.
yeah. Alright, so here's another thing I wanted to ask about. In another one of your articles on starting strength, you talked about how, barbell training has enhanced your clinical reasoning and decision making as a physical therapist. So I'm curious about that. How do you use the principles and methods in terms of diagnosis? And I don't know if you remember that article.
Well, what I would say is that just I think my background with strength training just gives me a little bit of a different perspective when I'm looking at things, and I look at how things work together, from a larger scale than in terms of the more isolated approach that we tend to take in physical therapy, and so you're, recovering from a rotator cuff surgery. you know, the very typical approach is isolated rotator cuff exercise, right? And in reality, when you're benching and you're pressing and you're doing rows and pull downs and those sorts of things, your rotator cuff's going to be very active, right? And you're also getting the additional benefit of training all the other muscles around it, right? Training
Mhm.
through longer ranges of motion, um, you know, more normal type movement patterns. So I think that it really just comes from having that perspective on things, and kind of thinking more about the bigger picture of how all this stuff works together, as opposed to looking at things from a more isolated perspective.
Okay. Yeah, that makes a lot of sense. And so, in addition to recovery, what about prevention, right? How does barbell training, strength reduce the risk of injury? I mean, you've alluded to it a little bit how like, deadlifting doesn't necessarily hurt your back. You can hurt your back anytime, so why not be stronger? But
Right.
like be very explicit about it so people understand how valuable that is.
Well, I mean, what we see from a research standpoint is that people that are stronger are more resilient to injury, right? You're less likely to hurt yourself if you're physically stronger. So, we see that in the research related to athletics and athletes that are prone to like overuse type injuries. If we're talking about athletes with lower extremity, overuse injuries, stress fractures, tendinopathies, things
Mm.
like that. And we break it down into, looking at, let's say, their 1RM, squat strength. Typically, the stronger athletes have a lower incidence of those types of problems, and to me, that just kind of carry overs to everything, right? So it's just going to make you more physically resilient to the types of issues that people a lot of times suffer from, because you don't have your that as low of a threshold, right? So the way
Yes.
that I look at a lot of these injuries, it's like, you accumulate these little insults that, maybe become painful at a certain threshold, right? Well, if your threshold's up here because you're stronger, then those things are less likely to be a problem for you.
Yeah, for sure. And I even like to think about when, as you get older, you think of frailty with
Hmm.
older folks, just the ability to fall or not fall at all because you have better balance. But even if you do, to kind of, if you're able to bench, multiple times your body weight, probably supporting yourself in a fall is going to be a lot easier than if you
Yeah,
can't.
I mean, I get asked by older patients all the time, how do I get up from the floor? I'm scared if I fall, I won't be able to get up, right? I mean,
Yeah.
those are things that if you're stronger, I mean, you don't really
Right.
have to have that same level of concern.
Right.
So yeah, I think that it helps with everything,
Yeah.
and
Yeah. Yeah.
it's really can't be more simple than that.
So we've covered so much. Before we wrap up, there's a question I do like to ask all guests. Not sure if you've listened to any of my other episodes, but it is, what one question did you wish I had asked, and what is your answer?
Hmm, that's a good question, I guess. Well, I guess one thing that I would say, and I don't know how maybe you would have asked this, but I don't want to give the impression that I'm like bashing on PT and
Mhm, mhm,
physical therapy. And there's a lot of different areas within physical therapy. And I deal with like sports and orthopedic type issues primarily. Sometimes I deal with some neurologic issues and things like that, but you can be a physical therapist in a subacute facility, in an acute care facility, in a hospital setting, and from that standpoint, it's a totally different
sure.
type of approach than what we do, in an outpatient setting. So,
Mhm.
I don't want to give the impression that I'm bashing on physical therapy. I mean, I think that I want the profession to be as good as it possibly can be, so that patients get the most benefit from it, and that's really where I'm coming from with this stuff.
Yeah, and I think, from my perception or perspective, everything you said is from a positive, value added, wanting to help people kind of perspective. So I
Mhm,
get it. And honestly, if we will all want the profession to improve for everyone.
mhm,
So even if physical therapists hear this and are like, "Huh, that's an interesting idea. Maybe I should learn about barbell training," then we've
mhm.
helped the profession. And I know plenty of physical therapists who take the traditional approach, and they're great people who mean well,
Right.
and they have great attitudes oftentimes. And so again, yeah, I agree.
And
There's
they're
no need to
still
do that.
th
Yeah.
th they're still helping people, and
Yes.
one last thing I would add, because I do get contacted sometimes by, young like, PTs that are just starting out,
Mm,
or student physical therapists, and they say, "Oh, I wanna get into this, I wanna do strength and conditioning and stuff," and they ask me, "What do I need to do?" And I always tell them, "You have to train yourself first," right?
mm.
So,
Yes.
there are a lot of people that they like the idea of what we're talking about, but if you're not training yourself, if you haven't gone through the process of getting yourself stronger and figuring out these little programming issues, and how to perform the exercises efficiently yourself, you're not going to be able to translate it to other people. So you have to train yourself if you want to get good at this stuff, and that goes
Definitely.
for
Yeah.
coaching, or from a PT standpoint.
Yeah, I agree. And as a nutrition coach, same thing. I would not want to help people with that unless I'd gone through it myself.
Hmm.
And everybody listening to this show is interested in this. And hopefully everybody wants to do that, regardless if they're a PT or not, that they want to get stronger and do the things you're talking about today. So, where can listeners learn more about you and your work, John?
Well, like you said, my full-time job, I teach at Adelphi University, which I love doing. I do work out of a clinic seeing patients part-time, a few days a week, on Long Island here in New York. But probably for people that aren't in my area, best way to get in touch with me would be through my wife's business, which is Progressive Rehab and Strength. My wife is also a PT, a very high level power lifter, much more so than I ever have been, and strength coach. And her business, we work with people remotely, all around the world. So that would be the best way to get in touch with me.
Okay. And that's progressiverehabandstrength.com.
Yes, you got it.
Okay, we'll put that in the show notes. And this was a lot of fun. We covered a lot, and I know the listeners gonna learn a lot. Hopefully, shatter some of the misconceptions they might have had, and really want to get out there and hit the gym and get strong. So, thanks again, man, for coming on.
No problem. Thanks so much for having me. I enjoyed it.